It is Thursday, April 22nd. Onerahtókha, Joe Dallarone, your Jets. Welcome to the Kahnawà COVID-19 Task Force Update. It is our 205th edition. And today, it'll be short and sweet. Joining us from the Kahnawà Memorial Hospital Centre is the Executive Director, Lisa Westaway. Lisa?
Good afternoon. I wanted to give an update regarding number of positive cases in the community. So as of today, we now have two active positive cases. All of the contacts have been reached out to and are in isolation. I also wanted just to let the community know that there have been an increase in outbreaks in the schools in communities around us. So just to be aware that there are outbreaks presently in specific classrooms at Billings, LCC, Lakeside, Centennial Park. So I don't give you this information to worry you, and you certainly don't have to be worried just because your child attends these schools. But there is one thing that I do want to tell you about, and that is that if you receive a letter stating that your child is in a classroom where there has been an identified positive case, that you call our local public health team to get information about measures that you should take for your child and your family. So what we've noticed, especially in the schools in Montreal, is that public health in Montreal is not necessarily following all of the same measures that we are following here in the Montérégie. So I'll be more specific. When we have a positive case identified in a classroom or in a classroom bubble, all of the children that are in that bubble are identified as contacts and are sent for testing immediately. However, in a case today, a family whose child is in a classroom bubble where there is a positive case in Montreal was told to not go for testing. So that is a different process that we have in place here in Kahnawà, and it's a really important difference and one that we want to ensure to catch within the community so that we don't, so that this doesn't lead to any outbreaks. Therefore, even if your school sends you a letter saying your child was in a bubble where there's a positive case, we do ask that you call and test your child and that you let our local public health team know so that they can give you advice for your child and your family moving forward until we can advise you that they're safe to either go back to school or to be out of isolation. Again, we're not asking you to call if your child attends one of the schools where there is an outbreak, only if you receive a letter from the school stating that your child is in a bubble where there has been a positive case. The next thing that we wanted to mention, well, I wanted to give an update about KMHC inpatient, just to let the community know that all the residents that are in isolation, as you know, have tested negative. They will be tested again on day 12. However, on a day-to-day basis and even twice a day, we do evaluate their well-being, their possible symptoms, and I wanted to report that all residents are doing well. There are no symptoms that have developed. There's been no further need for immediate testing. So that's really important for me to transmit to the community at this time. One last thing that I wanted to address was the rumor mill, basically, and we know that this is normal. This is part of any community where we have this desire to figure things out and know who is the positive case and lay blame when we can. And we see that because we went through such a period of time where there were no active cases, that it can be, I guess that we have this urge again, or we're coming back to ways that we were acting earlier on in the pandemic of placing blame on individuals that have COVID. And really, I want just to remind the community that COVID is a worldwide issue, as you all know, and it is not the fault of any individual if they do contract COVID, that it's a virus, that it's present, that we can do everything right and still have COVID. And so we have to be really careful about this, and what we've seen in the rumor mill is that people are wrongly identified as being positive, and therefore there is a lot of spite and hate against people who are non-deserving of this, and in fact nobody is deserving of this type of behavior. So we just want to remind the community that now is a time really to be supportive and kind and caring towards one another, and the same goes for those who choose to be vaccinated versus those who choose to not be vaccinated. These are personal choices, and it's important that we respect those choices of each individual. We all have our reasons why we make our personal choices, and it's important that we respect those personal choices. So of course, as a task force, we'll educate on all the reasons why we think it's important to be vaccinated. However, at no time will we put down people who choose to not be vaccinated. So this is the information I wanted to give to you today. Again, a reminder that COVID is among us, and it's still here, and although we have done everything right to protect ourselves, we still have risk in the community, and we still have risk in the communities around us. We do see numbers are increasing, even though they're relatively stable. Number of variants are also increasing, and we have to continue to follow this and be sure to follow all public health measures: distance, hygiene, masks, vaccination, well-being, and most importantly, well-being, looking out for each other at all times. Thank you.
Thank you very much, and very well said, Lisa. She did mention that if you need to contact public health, you can do so, and the best way to do that is via the Academy Memorial Hospital Center at 450-638-3930, and they'll put you in touch with the people you need to talk to. I think that should do it for today. We just have one mention that this will be a weekly program starting next week. We will not have the Tuesday updates unless there is a special reason to do so. If there's an emergency situation, of course, we could go on at any time, but we are now scheduled for every Thursday. We'd like to thank everybody who has taken the time to join us every time, and thanks to our technical crew as well. We don't thank them enough for the great work that they do. So thanks a lot, everybody. Take care of yourselves. We'll see you next time. Niao ko dano, wanigiwahi.